Thank you, Dr. Malkani and Dr. Harlan, and I'm excited to share with you today more about our study. My name is Emilee Herringshaw. I am a medical student here at UMass, currently on a year of dedicated research, but will be entering my fourth year come this May, which I'm very excited about. And today I look forward to speaking with you about a project that's actually already been implemented at the Diabetes Center of Excellence. So I appreciate all the support already, but would also like to provide an update on findings that we've had so far. The project is focused on cutaneous reactions to continuous glucose monitors. I'm interested in pursuing a career in dermatology and also have diabetes very close to my heart as somebody who's lived with it since age 2, and I'm now 28. So this is a really unique opportunity to collaborate between the two departments and pilot a solution towards a need that I'm sure you're seeing in clinic all the time. The idea here is that patients are reporting skin reactions to CGMs at a very high rate. There's actually quite a lot of variability in the literature, anywhere from single-digit rates to about 50% of the population. But the idea here is that it's a significant impact on patient quality of life to be experiencing these cutaneous reactions. And once they arrive, they remain chronically. So there's currently a lack of solutions to help patients really address this issue. This study was conceptualized via actually the online diabetes community because as an advocate online, I started to notice that a very prominent discussion started to emerge amongst patients with regards to these reactions and having them pop up, not knowing exactly what to do, and just the reality that they were becoming more and more prominent and they were really delivering an impact on their diabetes care and creating a dermatologic issue. So as you can see across Twitter, Facebook, really any platform, there's a pretty lively conversation happening from patients and they're looking for solutions. So that's where we can step in and help. And to do that, we have a survey out in circulation at UMass. So it's a collaborative tool between dermatology and diabetes, and it's a REDCap initiated survey, which is a standardized data collection method that will actually help patients inform us at baseline, so in a one-time event. And then they're also invited 6 months later to provide a follow-up survey. This can start to inform our understanding of the trends that are happening across sensors. And this will also allow us to identify patients who are experiencing what's called allergic contact dermatitis. So there's a lot of opportunity to profile this from a more of a comprehensive scale and help patients manage the variety of reactions that they are experiencing with a 5 to 8 minute survey that they can complete even when they're waiting for their appointment. Patients are experiencing skin reactions around 60% of the time with our small sample size that we've already collected information from. And of all devices reported on, patients were reporting skin reactions. So it's universal that to some extent there is irritation happening from any variety of sensors that are being utilized, but we look to further informing this pattern with the further data collection as more patients get enrolled in the survey. As just mentioned, through this data collection form and the discussion in the online community, patients are trying to make these reactions better, but they're not currently finding adequate solutions. And that can also be exemplified in the variety of interventions that have been attempted, even trying things from fluticasone spray to colloid patches. But the idea here is that they're trying and we can probably help them do a little bit better. So that's where this tool comes into play. And with regards to the severity of these reactions, we have noticed that on average, patients are reporting reactions on a mild to moderate severity scale, rated 1 to 5. And when that is segmented by device as well as location, those trends are persisting as of current. Again, we recognize this is a small sample size, but also look forward to investigating this with more granularity as we continue to collect our data. So in summary, we believe that characterizing these reactions and identifying CGMs associated with contact dermatitis can benefit both the dermatologic and diabetes care of patients using these CGMs. We recognize that there's a limited availability to manage the reaction as of current, and we hope to inform that with data collection and analysis. And we are hoping that eventually this could be externalized beyond the Diabetes Center. So positive news is that already internally, this survey will be translated to Spanish and Portuguese in the near future with support provided by the American Contact Dermatitis Society. But eventually thinking about partners like T1D Exchange or other platforms to help create even larger scale to this project that's so graciously been started here at UMass. So we're really excited about it. And I wanted to kind of bring bring this to everybody's attention, and also mention that I am welcoming and appreciative of any suggestions that can help further this work, because it's something that I'm passionate about on a personal and professional level, and I really appreciate everybody's support.